What if I told you some things nurses used to do every single day are now considered dangerous, outdated, or even malpractice? And no, this wasn't 100 years ago. Some of these practices were happening just a couple of decades ago. Let's talk about the nursing habits that didn't survive evidence-based practice and why they had to go. Welcome to Nurse Brain RX, where we share practical information for nurses and their busy brains. Healthcare evolves fast. What we once believed was best practice has been replaced by research, patient safety data, and hard lessons. So if you're a nursing student or practicing nurse, this isn't just history. This is a reminder. Question everything. Number 1. Routine back rubs to prevent pressure ulcers. Then nurses were taught to vigorously massage bony prominences to stimulate circulation. Now, this is strictly avoided. Massaging fragile tissue actually damages capillaries and worsens skin breakdown, especially in high-risk patients. What we do instead: repositioning schedules, pressure-relieving surfaces, and skin assessments. Number 2. Tight blood glucose control for ALL critically ill patients. Then, aggressive insulin therapy aimed for near-normal glucose levels. Now, we know this increases the risk of severe hypoglycemia, which can be fatal. Modern guidelines recommend moderate glucose control. Lesson: sometimes, normal isn't safe in critical illness. Number 3. Withholding pain medication to avoid addiction. Then, patients were often undermedicated due to fear of addiction. Now, pain is treated as the fifth vital sign. Untreated pain leads to delayed healing, increased stress response, and chronic pain syndromes. Current approach: balanced, patient-centered pain management. Number 4. Routine use of physical restraints. Then, confused or agitated patients were frequently restrained for safety. Now, restraints are a last resort. They increase risk of injury, delirium, psychological trauma, and even death. Modern nursing focuses on de-escalation, environmental modifications, and close monitoring. Number 5. Breaking sterile technique, just a little. Then, shortcuts in sterile procedures were sometimes tolerated, especially when busy. Now, there is zero tolerance. Even minor contamination can lead to sepsis, surgical site infections, and increased mortality. Key shift: infection prevention is non-negotiable. Number 6. Routine shaving before surgery. Then, surgical sites were shaved with razors. Now, this is avoided. Razors cause microabrasions, increasing infection risk. We use clippers or no hair removal at all. Number 7. Hyperoxygenation for everyone. Then, high-flow oxygen was given liberally. More oxygen equaled better. Now, excessive oxygen can cause harm, especially in COPD or post-cardiac arrest patients. We titrate to target saturation levels. Number 8. Mandatory bed rest for most conditions. Then, patients were kept in bed for extended periods, even after surgery. Now, early mobilization is key. Bed rest leads to muscle atrophy, blood clots, and pneumonia. Movement is medicine. Number 9. Using glass thermometers with mercury. Then, common, reusable, and breakable. Now, completely phased out. Mercury exposure is toxic and dangerous. Number 10. Reusing single-use equipment. Then, some single-use items were cleaned and reused to cut costs. Now, this is strictly prohibited. It increases infection transmission, cross-contamination, and patient harm. Here's the truth: nursing isn't just about skill, it's about adapting to evidence. What we do today might be questioned tomorrow. So stay curious, stay updated, and never practice on autopilot. If you found this helpful, you'll want to watch the next video on dangerous outdated nursing habits still happening today. Because some are still around.